Hey there, I have a hand dynamometer. What this thing does is allows us to measure grip strength. And so most of the time we use this when we do an initial assessment. And I'm not as interested in the absolute number, as in you pulled 70 pounds on your right hand and 80 pounds on your left hand. What I'm interested in is the comparison side to side, similar to the balance when we do the weight scales. I'm not concerned about the overall number. What I'm interested in is what's your left compared to your right. Now, on the hand dynamometer, measuring that grip strength, if you are right handed, you should be 5 to 10% stronger on your right side. If you are left handed, you should be about equal to your right hand. And I think that's because when you're left handed, you're forced to do some right handed activities. But the research shows that when you're left handed, they should be equal. When you're right handed, your right should be 5 to 10% stronger. That's important. But what I'm most interested in again is the comparison side to side. Now, we also want to see the overall number. Sometimes that increases as we get better nerve connection, because when there's pressure on nerves through the neck, what happens is that there's less brain to body connection, which means these things are weaker. Your arms and your hands are weaker. We see loss of muscle sometimes because there's less nerve connection. But the comparison, let's say for example you're right handed, but your right hand's actually weaker. As we get pressure off nerves, we expect that to change and the right side to begin to be a little bit stronger, a little bit stronger. Of course, if there's an injury or some damage to tissue on that side, we take that into account, of course. But it's like the scales. It tells us some information. We need to look at a bigger picture, and one test doesn't tell us everything, but it gives us a clearer picture on how much nerve pressure has been in a certain area and how long it's been there as part of the picture with x-rays and mobility and posture and balance and all those other parts of this assessment and reassessment we do.